Hello, my name's Sarah and I'm one of the physiotherapists.
Hi, I'm Stella, I'm a speech and language therapist.
Hello, I'm Kathy Brown and I'm an occupational therapist.
And we work for Nottinghamshire Healthcare NHS Foundation Trust.
And we work in the specialist services of community, intellectual, developmental, disability service.
So the reason that we wanted to start this project was because we wanted to be able to offer our service users something in the community, and we didn't really feel there was an opportunity for us to refer them into, so we got together to see could we help facilitate a project.
We're really keen to facilitate a sport or physical activity group for our service users within their local community.
Partnership was also with Boccia England, a gentleman called Pete who's been brilliant, and also day services at Nottinghamshire Healthcare Trust also wanted to be involved, and their people that attended their day services have come to the group, which has been brilliant.
The ways in which I feel like physiotherapy has helped is because I'm able to kind of tweak the exercises and the activity so that it's inclusive for them. And other ways that I didn't expect initially that will be beneficial is that they're all using the stairs to get up, their balance has improved picking the boccia balls up, just transitions, getting on and off the chairs, which has just been amazing to see their confidence grow.
From a speech and language therapy perspective, I was really keen to make the environment a total communication environment so that all methods of communication would be used and valued, and we could support that. And also a lot of work went into the preparation with accessible resources to make sure service users were comfortable coming to the group initially and well prepared.
And from an occupational therapist point of view, the boccia is a really adaptable group, activity for lots of different people, meets lots of different needs. So we've had quite a diverse section of people with different disabilities within the group. And things, for example, like a ramp, and that's helped with hand dexterity and things, and enabled them to throw the ball or for the ball to go further without having to throw it. And we've also looked at their motivation as well, and how that's actually improved over all the sessions, and how much enjoyment and the camaraderie between everybody, and the fact that they will pick up balls for each other. It's been a really good opportunity in a different environment, like Stella was saying, for this group to happen for them.
At the YMCA we are all about community and trying to provide opportunities for those that don't necessarily have access to these types of facilities, but also helping people to belong, contribute and ultimately thrive, and that's kind of why we wanted to get involved in this project. I've loved working with the people. The people are absolutely incredible. They play lots of different games, and we have nice, like we warm up with the YMCA song, and it's just really great and fun, and just to see like the level of growth as well and change. Working with a variety of different stakeholders and working with the NHS is given us that kind of confidence to be able to work with this type of population. Probably wouldn't have done this project without the support of the NHS, so having the NHS there and involved, it just gives us that level of confidence to be able to provide this type of service. That's been a really important and key part of this project.
My name is Liz Fletcher. I'm an occupational therapist and work for an organisation called Sport for Confidence. Sport for Confidence has a delivery site based in Essex where we use the expertise of occupational therapists and sports coaches, mainly based in leisure centres but in community spaces too. Sport for Confidence are a Sport England system partner, and so what that means is we're trying to elevate the work that Sport for Confidence does locally but on a national level, and so which led me to working with Notts Healthcare NHS to start working with the AHP groups and how we could devise a physical activity based group, and to try and get more service users, people with learning disabilities, into sport and physical activity. I've been really impressed with how Notts Healthcare have really started to work in partnerships with other organisations, and it's also really important to know about your active partnerships. There's about 26 or 27 active partnerships across the country, and in Nottingham there's Active Notts, and I think it's just important for healthcare professionals to know about their active partnerships, because they are the first contact point really for anything physical activity related.
The project so far has gone amazing, and it's just we really feel like it's a viable way that we could refer patients into, so that we're not just seeing them individually at home, but we can get them together and treat them as a group so that it's more meaningful to them and they're more likely to carry it on.
We're really positive about all the benefits to our service users' well-being, and it's the partnership working that's enabled us to run the group and be key to the success of the group.
So I think our final message would just be to any healthcare professionals that are thinking about, could we do this for our service users or the patients that they're working with? We can't recommend it enough. We've absolutely loved it, haven't we? And please, get in touch with us if you've got any questions. If we can do it, then so can you.